So this is the Figgy update. Yesterday he went in for his chemo and we ended up not being able to do his chemo because he has this large lump that's developed. His last chemo was 3 weeks ago, and this was 4 centimeters, and this time it was 8, I believe. I'll read the report for you later, or I'll take a picture of it and put it in here. But he's going in this morning to, the very first thing he's going to get is chest x-rays to make sure that it hasn't spread to his lungs. And if it has not, then he's going to have this removed. It's in a shadow right now. He doesn't want to show it. It's okay. You don't have to show it. It's okay. He doesn't want to show it. It's okay, baby. So I promised him that we're making the best decisions we can for him. It's a decision. There was 3 options. The first option was do nothing and just wait it out. And this thing's growing very, very rapidly. It has very high blood flow, which means that they have aspirated it at both these appointments. Once at the last appointment for his first chemo treatment and twice for this past one, but it has such a heavy blood supply that the cells are very diluted with blood, so they're not able to really get a good sample and great diagnosis on it. So the first option is do nothing. The second option is do a very, very high-powered chemotherapy so they don't know if this is osteosarcoma, which is what he had in his leg, which is the bone cancer that has spread to subcutaneous tissue, or if it is a sarcoma, which involves soft tissue. Both are different chemo treatments, and there is one chemo that does cover them both, but it's not intended for large masses like this, more microscopic cells. So that would kind of be what they would call a palliative care, trying to slow it. So the other option was to surgically remove this. So it has some involvement with the muscle because it is deep. And they will have to remove a portion of the muscle and still not have the type of margins they like to normally have. So they know they're not going to get everything. And he will have some discomfort after this surgery, but the muscles will learn to kind of redirect the way that they work. But he would go into chemo directly after that surgery to try and kill the remaining cells that they didn't get, which would at that point be hopefully microscopic cells. So this morning he's going in to the surgery. Ironically enough, yesterday they had a cancellation and they can get him in this morning. So his appointment was yesterday afternoon, and they can get him in this morning with the surgical team. Otherwise, had they not had that cancellation, it would have been about a week to a week and a half before he could get in with the surgical team. So a little bit of potentially a sign there. I don't know. Hoping that his x-rays are clear and we can make the best decisions we can for him. Poor Figgy does not deserve this. He's had a long road, and this is not, even the vet said, like, he's a young dog, and these are just, nothing has been normal about this whole, the osteosarcoma across the joint in the leg, which it doesn't usually do. If it's osteo spreading to subcutaneous tissue, it's also very rare. If it is a secondary type of cancer, being sarcoma, also very rare that a young dog gets 2 different types of cancer like this. He's not catching the good luck strand. Now, he has been very comfortable. He's, running around. He's been very, very happy. He's in good spirits. He's eating. He's not on any medications, nor has he been for quite a while. Obviously, he's going to be on some pain meds coming off of this surgery. They're going to get him in, drop off about 7 between 7 and 7:30, and the first thing they're going to do is some chest x-rays. So Figgy would appreciate it if all of his fans keep him in their thoughts and prayers today. And I'll update as to, I know baby, as to what the situation is. So we're going to hope that those x-rays are clear, and we can do something a little bit. I know it's more invasive, but do something a little bit more to help him have a little more quality of life, because he is so young yet. So Figgy says thank you for your love, your support, and your prayers. Yep, he says thank you. Everybody there knows him, and everybody loves him, and they all are trying to make the best decisions for him. He does have 2 interns plus the surgeon that all know him. Those interns are graduating here soon, so it's kind of cool that they've been able to follow him, and he's coming into hands that know him, love him, and have seen him through all of this from the beginning, from the early diagnosis. You got some tears, baby. You do. So I've told him we love him. I need him to be strong and know that everybody loves him. Yep, you got lots of people rooting for you, baby. Okay, he's loaded up. He's got his bed in here. He's got a bunch of animals. And for everybody who's been following him, there's his little warrior Build-A-Bear frog. Right, Figgy? Right, Figgy? Yeah. He's like, all my stuff. Yep, I do. Yeah, this is his traveling bed. Yeah, it fits good in here. Normally it fits perfect, but we've got a puppy going home today also. So the pup's up there, and he's ready to go, and he's going to keep Figgy company on his ride. Yeah. Okay, we love you, baby. Love you.